The federal government says it is taking up the responsibility of entrenching an orientation of provisions in the National Guideline on Self-Care for Productivity or Reproductivity and Maternal Health to achieve optimum outcomes, especially among populations in the communities. The government, through the Ministry of Health, said this is a step in the right direction following the benefits of exploring self-care commodities by empowering beneficiaries and its resultant reduction in burdens on the health facilities. The report.
Statistics from the World Health Organization states that Nigeria has an estimated maternal mortality ratio of 917 deaths per 1,000 live births, making it the fourth highest globally. But experts in sexual, reproductive and maternal health say promotion of safe use of reproductive self-care commodities will reduce the country's maternal mortality rates.
Guideline for Nigeria is focusing on sexual and reproductive health. So first of all, contraception and family planning. And for us in Nigeria, the inroad is the self-injection of Cyana-Press. So that is what we are using as an inroad to ensure that this policy is implemented. But apart from that, we also have the HPV self-testing. That is the screening for cervical cancer, because we know that it is also very common among women and it is preventable. So instead of a woman to go to the hospital for a pap smear, there's a pack that she can actually use to screen herself. We also have the HIV self-testing.
We've gone to 23 states. We've worked with them and helped them, to see which are the critical areas that they can start with in terms of implementation and look, because the guideline also has a section, costed implementation plan. So they work on this with our help and they are guided. And of course, various states have different strengths and depending on who is in charge and so on.
Adopting modern practices and self-care intervention for sexual, reproductive and maternal health are said to have some dangers without proper orientation, like every other medical commodity, but there is the need to have a first contact with the healthcare system.
On a general sense, there are self-care interventions that have been listed in the guideline, and those are the ones that are within the framework of self-care that people can use after they have had appropriate contact with the health facilities. Some
of the products are available in the health facilities. Some you can get over the counter, and then of course you'd have had contact with the health system so that your awareness and sensitization is increased, and you know how to ask questions. You know that when there's a problem, they would have given you things to look out for. You can go back to the health facility.
The initiative, according to experts, is not only aimed at improving self-care practices but also to reduce child and maternal deaths, infertility, cases of sexually transmitted diseases and infections, improve family planning practices by leveraging the availability and affordability of modern technology in sexual, reproductive and maternal health practices with or without the help of a healthcare provider. Aisha Salihu, Trust TV News, Abuja.